everyone. I'm Dr. Geoff and I'm a professor of pediatrics at the University of Alberta in Edmonton. I'm also the Alberta Health Services Chair in Obesity Research. And I also have an adjunct appointment to the Department of Agricultural, Food and Nutritional Science, also at the University of Alberta. And up until a couple months ago, I was the founding director of the Pediatric Center for Weight and Health, which is a multidisciplinary pediatric weight management clinic at the Stollery Children's Hospital in Edmonton. And that's transitioned to a colleague of mine, and I'm still involved in the clinic from a research capacity. In general, the work that I do relates to managing and preventing obesity in children. A lot of the work I've done historically has been related to work at our local clinic, but I have a lot of projects now related to multi-center trials, a lot of multi-center work that we're doing with colleagues across the country. So there are about 20 or 30 clinics that provide specialized weight management care for children and families across the country. And we're working hard with colleagues across the country to do work that's hopefully meaningful for families and ultimately improves the care that we provide for children and youth and families dealing with obesity. And I should say my background is in nutrition. So I have an undergraduate degree from UBC in nutrition and ended up coming to Edmonton to become a dietitian. And after a few weeks, I realized that I enjoyed nutrition, but I was, I guess, hungry for a little bit more. So one of my professors from UBC moved to the University of Alberta around that time. And I started graduate studies with her and finished my PhD, and then moved to Los Angeles for a few years to do postdoctoral training, and then was fortunate to have a position here back in Edmonton in 2004. So I've been here ever since, not just with our clinic, but also leading research with multiple methods. So I'd say that's one of the things that I've learned over time. Probably the thing that's been the most interesting for me is to expand not just the content area, but to expand expertise and develop other specializations in research methods. So our research group does a lot of different types of studies related to preventing and managing obesity in children. And we do studies related to qualitative research. We do some epidemiology, some clinical trials, a variety of different methods to answer different types of questions. So I'd say that's one of the things that I've learned the most over time, is that it's important to have a big toolbox with lots of tools and methods to be able to answer questions that are timely and important in whatever field you're in. Even though most of my work is in obesity, it does transcend other areas. And the methods have helped me to sort of expand and grow academically over time. And I'd say the work that I do is important to me because I grew up in a family where I remember as a child going to Weight Watchers with my mom and other family members. So weight and health was always an issue within our families. It was always a topic. I was always interested in nutrition growing up, more from sports nutrition originally, and then into more, I think, areas of probably greater relevance to more people, because obesity affects, a large proportion of children and youth and adults across the country. And historically, we haven't had great health services for managing obesity. And the work that I've done hopefully has helped to improve the care, help to improve the care that clinicians provide for families in a sensitive way, in an evidence-based approach. And hopefully, I think some of the research that we've done over the years has helped to contribute to that evidence base. One of the things that I'm spending most of my time on these days is something I was never trained for, and it's to develop clinical practice guidelines. I'm working with the national group, including Obesity Canada and the Heart and Stroke Foundation of Canada, to establish guidelines for managing obesity. And we're working with caregivers, individuals with lived experience, a number of clinicians, both from rural and urban settings, primary care, tertiary care, and lots of academic folks across the country. And I'd say that's probably the thing that excites me the most, and that gives me the most satisfaction, is to learn about the process, but also to learn about what evidence exists. I've been studying this area for a number of years, and it's still surprising to me when I come across new articles, new evidence of things that I haven't heard of before. But working with people from multidisciplinary backgrounds really broadens the lens with which we view obesity, and hopefully the work we do over the next year or so will be meaningful for clinicians and for families in managing obesity across Canada. The other work that we're doing actually with Obesity Canada that's more emerging is to adapt the guideline once we develop it for other countries. So working with colleagues in other countries in Europe and in South America. So the international implications of the work we're doing here in Edmonton and across the country is really exciting, and it's a really neat opportunity. I'd say the last thing I'd mention that I think is relevant for many of you, if you're students, is the information I had when I was a student is so much more limited than what you have access to now. And if you're thinking about a career as a clinician, or you're thinking about a career as a researcher, or maybe as a clinician scientist, then it's so important to pick an area that you feel passionate about. And I imagine that's advice you've heard before if you've ever asked anybody about career advice. But I'd say if you're thinking about a career in science, then beyond the topic and beyond the content area, it's critical to have expertise in research methods. The content expertise that you have, whether it's in cardiovascular disease or diabetes or any number of conditions, the content area, the content expertise can always develop, but the research methods you take with you. So if you have experience in qualitative inquiry, or if you have experience in epidemiology or in clinical trials or whatever sort of research method, that will always stay with you. And you can apply that across multiple content areas, because lots of colleagues of mine have sort of evolved and reinvented themselves in different topic areas, but they take those skills with them. And I think that's a critical piece. So if you're thinking about a career as a scientist or as a clinician scientist, the key, I think, is to work with people who are leaders in the field, if you have the opportunity to do it, because you'll learn so much from folks in how they run their business. Because a lot of us, the way we run science is we all are sort of small business owners, and we have to secure research funding to fund the research we do and to support our students and our research staff. And if you have the opportunity to work with someone who's really productive and available and generous with their time and collaboration, I think those are really key features that I've learned from my mentors over time. And I hope that my trainees have had good experiences with me because of the experiences I've been able to share, or I've been able to have and then hopefully share with them. So the key is to be really good with your methods. And if you love writing and you're curious and you've got ideas and you want to pursue them, then a career as a scientist or as a clinician scientist is a great way to satisfy that motivation and that opportunity. So regardless of where your career takes you, I wish you luck. Follow your passion, work hard. That goes without saying. But if you're able to collaborate with people who are like-minded and you can contribute to their work and they can contribute to yours when it's mutually beneficial, that's the perfect storm. So as your career heads forward, best of luck.